Thousands of patients who see their doctor at an Optum medical office were shocked to find out last week that about 90 clinics across the state will close at the end of this month. Optum, which is owned by United Health, filed warn notices with the Department of Labor in October, announcing 572 workers would be laid off. In some communities like Hoboken, parents are reeling, trying to figure out where to take their kids for pediatric care. Raven Santana spoke with several of them as they reacted to the news.
The abruptness of it and not even finding out the right way from the actual provider, to me, is just, it does not sit well. So Optum, you need to do better.
Longtime Hoboken resident Amber Nugent is among the thousands of families across New Jersey scrambling to find new doctors after Optum, one of the nation's largest healthcare providers and a subsidiary of United Healthcare, announced it will close nearly 90 medical offices by the end of the month, citing a need to meet the needs of the people we serve, our business, and evolving market dynamics. So is Joanna Louisi, whose children have been Optum patients since birth.
They're going to not give us 6 months notice to sort of get all of our ducks in a row and get our records and figure out our next move. And it's in sick season, like flu season, cold season, like all this is starting, all the holidays, and they're just shutting down with like no warning. And I think that's what irritated everybody and myself.
According to warn notices, the company will leave nearly 600 employees out of work between February and March of 2026, and patients statewide scrambling for primary care, pediatric, and specialty providers. And in Hoboken, parents say the insult came before the injury after they found out on Facebook and not from their doctors.
I was tagged in a social media post. That's how I found out that Optum was closing all the pediatric offices in town. A town that has, I think, close to like 12,000 children.
Louisi has lived in Hoboken since 2009 and has brought her two children, now 9 and 6, to Optum's Clinton Street location.
Fine, you're trying to save costs. Maybe keep one main location and try and move all the doctors in that, and then you don't have rent at one location. I don't know if that's feasible, but something to just all of a sudden say, 29 days, we're gone. Sorry, find new doctors for your children.
Optum may be staying put here in Hoboken at this location, but families I spoke with say the damage is already done, and they say the short notice has caused confusion and delays in care.
I'm one of many that are very frustrated. I think the biggest word would be that we're all just so disappointed. I mean, how do you do something like this with little to no communication, with no advance warning, and not think about the regard for the families? So I think everybody is just extremely disappointed, and I don't think Optum frankly cares about what the families think.
Nugent, whose children have been Optum patients since 2008, says she was equally blindsided, even trying to get clarity by speaking with staff at her doctor's office.
So I walked into the office on 2nd and Clinton, and I said, "Is this true? I'm actually not sure if I believe this." And they said, "Yes, we're in as much disbelief as you are."
Public outrage pushed Optum to partially reverse course, announcing it will keep pediatric services open at the Bloomfield Street site past December 1st. They released a statement saying, "In the past week, we've heard patient feedback and understand the impact these changes have on those we serve. We've been moved by the outpouring of support for pediatric services in Hoboken and have decided to continue care at that location."
Well, we know that we already have access issues, that people are waiting a long time to see a primary care provider, and some primary care providers aren't even taking new patients. So you may have long wait times to find a new provider.
COO for New Jersey Healthcare Quality Institute, Tyla Manair, says patients need to act fast to protect their care.
Get those refills, get refills of your prescriptions, and then get access to your medical records. Just in the event that medical records are lost, you want to make sure that you have access to those records and that you're bringing them to your new primary care provider's office.
Optum says a transition team will help answer questions and refill prescriptions for the next 6 months, but most of its 90 offices will still close by the end of November, and behavioral health services will be discontinued statewide. For NJ Spotlight News, I'm Raven Santana.
Support for the Medical Report is provided by Horizon Blue Cross Blue Shield of New Jersey, an independent licensee of the Blue Cross Blue Shield Association.